Hello everyone, my name is Saroj Bangade. Today's date is 24 June 2022. Today's video topic is CDM. Clinical data management. Clinical data management (CDM) is a critical process in a clinical research which lead to the generation of a high quality, reliable and statistically sound data for the clinical trial. So clinical data management ensure collection, integration and availability uh, of the data at appropriate quality and cost. It is also support the conduct the management and the uh, analysis of the studies across the spectrum of the clinical research as defined by the National Institute of Health. So the ultimate goal of the CDM is to ensure the conclusion drawn from the research are the well supported by the data. Achieving this goal protect the public health and increase the confidence in the market therapeutics. Uh, Standard operating procedure. SOPs describe the process to be followed in the conducting data management activity and support the obligation to follow the available law and guideline. So example is the ICH GCP and 21 CFR Part 11 in the conduct of the data management activity. Data management plan. Data management plan describe the activity to be conduct in the course of the processing data. Key topic to cover include the SOPs to be followed, the clinical data management system to be used, description of the data source, data handling process, data transfer format and the process, and the quality control process. So case report from design. The case report form is the data collection tools for the clinical trial and can be a paper, electronic. Paper CRF will be printed often using no carbon required paper and shipped to be the investigate site conducting the clinical trial for the computation, after which they are courier back to data management. Electronic CRF enable data to be typed directly into the field using a computer and transmitted electronically to the data management. Design of CRF need to take into the account information required to be collected by the clinical trial protocol and intended to be included in the statistical analysis. So apart from the CRF design, electronic design also include edit check programming. Edit check are used to fire a query message and when the description data is entered to map certain data point from one CRF to the another. Calculate certain field like subject, age, BMI, etc. So data design and build up. For clinical trial, you are utilizing an electronic CRF database design and the CRF design are closely linked. So active phases. First is the data entry. When electronic CRF is used, data entry is carried out the investigative site where a clinical trial is conducted by the site staff who have been granted appropriate access to do. Using a paper CRF, the page are entered by the data entry operator. Best practice is for a first pass data entry to be completed, followed by the second pass or verification step by and the independent operator. Next is data validation. The data validation is application of validation rules to the data. For electronic CRF, is the validation rule may be applied in the real time at the point of entry. So data query. When the data entered does not pass validation rules, then a data query may be issued to the investigate site where the clinical trial is conducted to request clarification of the entry. So central laboratory data. Sample collected during the clinical trial may be sent to the single central laboratory for analysis. Next is the external data. Analysis of clinical trial data may be carried out laboratories, image processing specialists, or the third parties. Serious adverse event recognition. The CRF collect the adverse event report during the conduct the clinical trial. However, there is a separate process which ensures the serious adverse event are reported quickly. So, data finalization and the extraction. Once all expect data is accounted for, all the data query closed, all external data receive and the recognize and the all data management activity complete the database may be finalized. So this information about the clinical data management. Thank you.